What's up guys, Stratton Polson here, your favorite chiropractic intern. And today I want to share a little bit with you about something that's come up a lot recently in conversations I've had with some of my patients. And I'm going to share with you a couple of statistics and facts from this wonderful book, which is Integrating Manual Therapy and Pain Neuroscience. It's done by a bunch of doctors of physical therapy, and this is about basically imaging and scans. So you went and you got an x-ray and it showed degeneration, or you went and got an MRI and you have a disc herniation, or you have a meniscal tear, or you have a labral tear, and now you're being told that this finding on the imaging explains the pain that you're having. And what we've actually found through studying imaging is that a lot of times asymptomatic people who don't have really any symptoms at all, when they get a scan, there are abnormalities that are found on that scan at a pretty high rate. So the link between the findings on your scan and your actual clinical symptoms is not very strong. So let me give you a couple examples of that, right? When they did a study, it's estimated about 40% of asymptomatic people, so people having no pain, will show a bulging disc or a disc herniation on MRI. And then additionally, when you look at studies, most disc bulges actually spontaneously resorb on their own. I believe there was a study that was done in Europe that I was reading. I'll try and link it down below. I think the incidence was somewhere around 60 to 80% of the individuals studied that showed a disc bulge or herniation on MRI within 6 months to a year had spontaneous resolution. So it had resorbed and resolved itself on its own. But it's not just limited to the back. So there have also been studies that have been done with MRIs in the cervical spine, so in your neck. And 90% of people with no symptoms, asymptomatic people, 90% had a bulging disc in the cervical spine, and some of them were even in their early 20s. So abnormalities that we find on scans don't always correlate very tightly to the symptoms that you're having. But let's also talk about some other findings. So also in the neck, people with significant degenerative changes, like you might see on an x-ray, even in people with significant degenerative changes, only about 10% actually experience symptoms of neck pain that are consistent with degeneration. People with shoulder issues. So in people over the age of 30, 2 out of 3 people have abnormal MRI findings. And if you MRI the right shoulder versus the left shoulder, let's say someone has right shoulder pain, there are just as many abnormal findings in the left shoulder, the uninjured or unaffected asymptomatic shoulder, as there are in the right shoulder, which is the shoulder that's hurting. So if there's just as many abnormalities and the same types of abnormalities, how can we be certain that that labral defect is actually causing your pain? Similar to the knee. So in asymptomatic individuals, 20 to 50% of MRI scans reveal significant degenerative changes, highlighting the poor correlation between knee osteoarthritis and knee pain. So if you've been told you have osteoarthritis in your knees, or knees are degenerated and that's what's causing your pain, 20 to 50% of people that have no pain in their knees at all also show those same changes on MRI. So it really begs the question, if I've been told that my knee is degenerated, my hip is degenerated, my shoulder has a labral tear or a rotator cuff tear, or my cervical spine is degenerated, or my low back has a disc herniation, unless you're showing specific clinical signs that are highly correlated to that thing. So let's say you've got a disc herniation and you've got shooting, burning pain going down the leg all the way into the foot. When your clinician raises your leg as you're laying on the table, it reproduces that symptom reliably, then yeah, maybe your disc herniation is the primary cause of your pain. But if you just have low back pain, it's not radiating your legs, it's not going anywhere, and you have a disc herniation on MRI, that disc may not necessarily be the cause of your pain. If you have shoulder pain, even if you go in and get an MRI and they say that you have a labral tear, you have a rotator cuff tear, that may not be the cause of your pain. If you have knee pain and you get an x-ray and it shows degeneration or osteoarthritis, or you get an MRI and it shows that you have a meniscal tear, unless your knee is locking up on you, preventing it from moving, it may not necessarily be the cause of your pain. And a lot of these pains can be dealt with adjusting, so manipulating the joint in question, soft tissue work to the muscles around the area, and then physical therapy type exercises that help bring strength, stability, and support to that region. Because a lot of times people with osteoarthritis, they just need the muscles to pick up some of the extra slack from that joint, and their pain goes away entirely. So it's not the degeneration that's causing the pain, it's the excess stress going through the joint because the muscles are weak and you're having to offload some of the force into those passive structures like the ligaments and into the bones. So I hope that this kind of helps you guys conceptualize scans. The important part about scans and x-rays and MRIs is if you're not improving after trying conservative care and your clinician is worried that there may be some underlying pathology that we've missed, scans can be really important because we might catch a fracture, a dislocation, we might catch a neoplasm, some kind of cancer, although that would be very rare, or an infection that could explain the pain that you're having and why conservative care hasn't been successful. But we have to be really careful not to just see a finding on imaging and decide, oh, well, of course your shoulder hurts, here's this labral tear. Because as it turns out, you may have the same tear in the shoulder that's not bothering you. So I hope you guys understand that a little bit better. Don't worry too much about the results of your imaging or of your scans. I know the process makes it seem very, very concrete and decided and definitive, because what we're supposed to do as clinicians is communicate those findings. That doesn't always mean that's what's causing your pain. So get out there, get moving, and I bet you'll feel a lot better. See you next time.